Good morning, everyone. I'm Susie Cannon. Welcome to our Hope 2020 Conference, Day 2. I hope you enjoyed yesterday. So sit back and relax, and we'll get started soon.
Everybody, I'm Porter, and I'm glad that you're here with us. I know that some of y'all are watching from our YouTube channel, which is awesome, but all of our raffles, giveaways, questions, and answers is all going to be done over on the Facebook Live page. So make sure you're checking that out, and I guess that's it. So, hey, let's get this thing started.
Hi, my name is Marquez Washington. I am the Hemophilia Community Liaison, also referred to as HCL with Novo Nordisk. I cover Southern California and Hawaii. One thing that I admire about the community is the social support. Being part of a community that continues to create programs for education and engagement is so important. I'm so excited to be part of the community, and I'm looking forward to connecting with you. Hope to see you soon.
All right, I've got my good friend Tabitha McGlinchey with me today, and it is so great to see you from octapharma, calling all the way from the great glory land of Dallas, my hometown, and it is so great to see you. Thanks for joining us for this Hope Conference.
Thank you for having us. We're really excited about it.
Yeah, well, we have had quite a year, haven't we? And it has just been so unusual, but I just always appreciate octapharma's support, but especially in a year like this where we have so many unusual things going on. One of the things I love about your organization as a whole is just that you guys are always willing to be a little bit creative. I think that's evident with not just with what you do with Hope, but with other groups as well. And so appreciate you guys thinking outside of the box and being a big part of this weekend with us.
Oh, you're welcome. You're welcome.
Well, tell me a little bit about, for those folks who are tuning in right now and seeing you for the first time, maybe they don't know so much about your background, but tell me a little bit about where you're from and how you got into working in the hemophilia world.
Sure. Thank you, Jonathan, by the way. And, we're just really privileged to be a part this virtual reality now that we're living in now. But we're always so incredibly thankful to be a supporter of Hope and everything that you guys do for the community. So just thank you on a side note. So my name is Tabitha McGlinchey, and I am a coagulation sales specialist for octapharma. I've been here for about 5.5 years now, and I've been in the industry 24 years, but mainly focusing in hemophilia for about half of that. And gosh, I guess it was over 10 years ago, I got into the hemophilia community. And since then, I have been in 9 different states, really working with the bleeding disorder community and the von Willebrand's community and the hemophilia community. And just, I always say it's such a privilege to be in this particular specialized field because it is. We're the only field in pharmaceutical that have access to the families and the patients and work together, of course, with our treaters and the specialty pharmacies and the foundations to hopefully bring the best service that we possibly can.
That's awesome. So tell me a little bit about, you have been, of course, through a lot of changes in the time that you've been in the hemophilia community for sure, but tell me a little bit about what you're excited about and what's coming down the line with your role with octapharma.
Well, I always, first of all, I always try and talk about octapharma a little bit because, I don't, my old joke, now this was 5 years ago, is that we're the biggest company you've never heard of. And that is a joke now because I think there's so many people that are so much more familiar with who our company is. And, I want to tell you a little bit about, Jonathan, I know you're really, really familiar with a lot of people here at octapharma, but for those of you who aren't familiar with octapharma, we are the only privately owned company left in the bleeding disorders arena. And we're also one of the largest privately owned companies in the world. So our company is owned by one family. And Wolfgang Marguerre is the father, and he started this company in 1983. And he runs this company with, he has 2 sons and a daughter, and they run the company together. And, we employ over 9,000 people in all over the world, and we service over 100 in our products, are in over 118 countries. And so we service all those patients in 118 countries. And, it's something that we're very, very proud of for a number of different reasons. Wolfgang founded the company in 1983 simply on the fundamental principle of improving the safety and the lives of patients around the world. And, by doing that, we work really closely with the scientific communities, your physicians, your treaters, research, and patient associations around the world, just like Hope here in the United States. And we're hopefully able to develop a deeper appreciation of the needs and the challenges of those that we are so lucky to service. And we take that very, very seriously. When we meet with patients, every patient is different with hemophilia, as we know, and every family has their own challenges. And I think if we were not able to meet face-to-face with patients, how would we ever know, truly what their individual needs are? So we feel very fortunate. We say that every time we have a program or we have a virtual, something like we're doing right now, because everyone is Zooming for work or working from home or Zooming with their kids. There's a new level of stress that has come into play with everything that we're dealing with COVID and just, the typical environment that surrounded that. So we truly appreciate when people take the time, just to visit with us, whether it's, face-to-face, which we hope that it will be again soon, or whether, it's on a computer. It's just nice to see each other's faces. So we take a lot of pride in that.
That's great. And it's evident that really since the very beginning, I know Mr. Wolfgang really was working on a very fundamental process early on that really helped to change the game with HIV and some other things. And so
absolutely,
it was so focused on caring for individuals that it really extrapolated into something much larger. And there's a lot of great stories out there. I know that some of them are probably buried in all the other great content, but I've heard some amazing stories about the history of how octapharma got started. But it seems like the theme has always been they're very focused on the individual and always been focused on caring for the population in ways that you just don't see everywhere. I love that.
Thank you for mentioning that, because we are very proud of that, and maybe we don't talk about it enough because it's just something that we know and that we do find special. But yeah, you're right. Actually, octapharma was the first company to apply the solvent detergent virus inactivation to factor VIII production. Our founder, he founded it in 1983. Mr. Marguerre, and he partnered actually with the New York Blood Center in 1984 to develop the breakthrough solvent detergent, inactivation system at that time. And so it really is something we're so proud of. And again, we live by that mantra of we want to make patient lives safer and better. And I think through our product line, and we've got products that really only service 300 patients in the United States, but that's important to us. And when there's a patient, one of 300, that you can provide an effective treatment for, that they can infuse at home, it changes their life. So we really are very, very proud of that. Yeah.
That's great. And you guys still have blood collection centers and plasma donation centers all over as well.
We do. And, we do have blood collection centers and plasma centers. And, we think it's important to let everyone know that these are not contract workers. Mm-hmm. These employees are, they are employees of octapharma. And we take a lot of pride in that because we do have very high standards for a lot of these centers. And we're growing by leaps and bounds. I mean, we've doubled our plasma center in the past few years. And, every now and then you'll be driving somewhere and you'll see an octapharma plasma center. So yes, we do. We own our own. Everything that, we take in there, we ship off to Europe, and we manufacture products based upon the US FDA guidelines, and then we ship it back. So it's really important, and we take it very seriously.
It's incredible. And I have to say, give a shameless plug here for the plasma centers. We have done, superhero runs and different 5K events. Yeah. And they have always been so kind to send a whole team of people, usually from those plasma centers, will come hang out with us and help us with setup and tear down. And I just love how all of the staff and employees really do have that thematic, similar heart. It's really, there's heart in it. It's not just a job. It's not just a responsibility, but it's something they really do. You can tell there's care put into the whole company.
And I think, another thing, or another very, very special project that octapharma had, and I just want to mention this, we have a product called Nuvic for severe hemophilia A, Will8 for von Willebrand's, and then Fibrica for a factor 1 deficiency. And we do not have a factor 9 product, but, we have a very special relationship and partnership with Chris Bombardier. And I really want to just talk just a little bit about it, because his movie is now available on iTunes. And, octapharma was proud to sponsor Chris. He's a mountaineer who made history as the first person with severe hemophilia to summit Mount Everest. And, he documented that in a documentary called Bombardier Blood. And I don't know if most people know, but octapharma was the sole sponsor of that documentary, and also his table book. That is a beautiful table book that has these gorgeous pictures of his climb and a lot of the charitable things that he did while he was having this experience and this journey that he was on. And so we're just so proud of that, and just proud that, there's someone like him that can inspire, hopefully, a lot of kids, because clearly he has overcome a lot to go to Mount Everest, which I know, Jonathan, you and I would probably never think about doing that. So
yeah, I get a little winded just looking at pictures of Mount Everest, so I'm not
I'm indoor food, not outdoor food.
I would say though, when I I was around when a lot of that early planning was going on, and I do have to say that it was inspiring to me, and I think again just another big reflection of Mr. Marquez's heart and just the whole company as far as getting behind an area of support for the community, for the patients that were in Nepal, and all the people that really are helping us save one life, and so many others. I know that there's been several people that y'all have been big supporters of them as well. And the whole process, I think that of really helping those who, and especially in a situation where you're serving a portion of the community you don't even have a product for. I mean that really should speak volumes of the passion, the heart, the commitment in a way that I don't think everybody always focuses on, but it's really.
Well, thank you for saying that. It is very, very important to us here at octapharma.
Yeah. Yeah, well, you can tell, and I love that genuine spirit. So, thank you guys for all that you've done, really for the global community, not just for the U.S. as well. I also think you guys make you mentioned von Willebrand's disease. You're one of the primary, one of the larger companies that provides medication to that segment of the community as well. And in some ways, that's an underserved population. I'm amazed at how much you guys do in that space that, again, is not everybody realizes how big you guys are in that world.
Right. Yeah. I mean, that was really, our first product was our Will-8 for von Willebrand's population. And now we actually have an indication for hemophilia. So, that can be, that population along with the hemophilia population can be serviced with that one product. But yeah, that came out years ago. And then of course, oh gosh, I guess it's been almost 4.5 years ago, we launched NuVeek, which is our human cell line factor VIII product for severe hemophilia A. So yeah, and then Fabriga came out. So yeah, we're always focusing on research and new products that we can bring to the market to hopefully help people.
Well, I encourage people to look into the science on this too, because I think the human cell line recombinant product that makes you really unique. There is not another one on the market that does what your product does, and for factor VIII specifically. And I think it's really remarkable, even the work that's been done in inhibitors, and the inhibitor segment of the community has really been remarkable. I think the research and the data there is pretty impressive. So I just think it's good for people to look into.
Yeah, and we actually, and this just happened, we actually just got our indication for PUPs, previously untreated patients, and we have one of the largest trials it's actually the largest trial that's ever been done with over 100 patients in that particular area. So we're so proud of that, and the actual inhibitor rate was so low comparable to like a plasma derived product, though NuVeek is completely recombinant. So yeah, there's lots of good things happening, and we have a lot of good data for patients. So thank you for encouraging them. And I always encourage patients, no matter what, go on all the websites, educate yourself, because there's just so many more choices clearly than when you grew up, Jonathan. It's a totally changed world.
Totally different place than where it was. And again, I just think that safety element is so interesting. And amazing to see what you guys are able to do and have done for the community. I know one thing that I got a chance to go to the World Hemophilia Federation a couple years ago. Yep. And I walked in the room, and here was octapharma dead center. I mean, probably the biggest booth in the room.
Yeah.
It's funny because going to a lot of the activities in the U.S., you see like, oh, this company and that company, this company and that company. But to walk into the World Federation and see this just enormous presentation, and I do have to say, I'm a little biased, but I do have to say you guys had the best espresso in the room. So lots of good things going on there. But
for that too. I
know, right.
We have it covered. Yeah, we have a.
Can y'all put that in a vial? Because honestly, I mean, I'm pretty good with the whole factory thing, but I'm just saying, like, if you could get espresso in there somehow, I would be totally, that would, you know, customer for life.
Yeah, we have a very, very large presence in Europe, and it is, I think, again, thank you for mentioning that. It's quite surprising when you walk in the room, and we're just a huge presence in Europe. And I think we're a very large presence in the US too, but again, it's like you said, it's so different when you're going to this global meeting and so many people from so many different countries, and, and we're really cemented in that community. So
well, I was fortunate enough to go to a couple of the abstract presentations that were done by some of the scientific research that had been going on behind the scenes. I actually got to meet a few of the scientists that are working in the labs in early animal trials before it even goes to, you know, the human trials. And so some of the things that are being worked on, and the passion. I mean, I've met quite a few scientists throughout the community, and the passion of some of those folks was really notable. I mean, it really, I'm not saying that just to say it. I mean, I'm telling you that, you know, it was remarkable to see how much they were just so giddy over, like, oh, you're never going to believe, you know, and it was just so funny, you know, things that they can't really say or can't maybe go into detail about even from a stage, but it was just like, oh, and guess what we're doing now, you know? And I'm like, this is a really nerdy person that knows numbers and data and looks at tiny microscopic cells every day. But I mean, he's making me excited, and I don't even know how to look through a microscope.
It's so great to talk to a lot of these people, you know, and we actually have met, you know, Tobias is Wolfgang Marger's son, and we've met some of the scientists that have come over and spoken to us at octapharma Corporate, and there's so personable and excited and just, you know, just the sweetest people. And yeah, so it is, it's exciting to be able to talk to them and just ask any question you want. And they're able to, in layman's terms, because that's how I need it,
right,
you know, give you answers so you understand it and you can break it down for yourself. And then, of course, for people you talk to. But
that's so true. Well, I know that there's a lot of changes going on, but we've got this Hope Conference this weekend, which I'm just, again, so thankful that you guys have been able to support. And you have a lot of presentations going on, a lot of activities going on this weekend. And I'm so excited about each one of them because there's just so many different aspects that I think are going to be meaningful for folks. But tell me, if you would, what your favorite thing is about Hope Conference and what you look forward to about the event this weekend.
Oh gosh, I mean, I think it's just how you guys are putting on Hope Conference to make it as interactive and as real as you possibly can. And I know, Jonathan, you showed me a short clip of a presentation. I said, oh my gosh, it reminds me of the stage you guys used at the gala. And it really is, you know, trying to make this as close and upfront as possible as you can get. And I just think, I'm just excited about the whole conference and the many different presentations, not just ours, but others as well. And of just seeing people's faces, you know, that you normally don't get to see. And we hope that that changes. But yeah, just living in this virtual world, it really does make a difference when you guys go above and beyond and the extra that you do, just to make this as engaging and as real as possible. And that is not an easy thing to do. And it takes a lot of work to be able to do that. So.
Well, you know, we hear people say that a lot about our physical events. When people come, they say things, and this is really other people's feedback, that they would say things like, man, I've been to a lot of events before, but I've never experienced anything quite like the Hope Conference. I've never experienced anything that was so warm and so engaging and so real and so authentic. And those are all words we hear a lot. And I would say that we work really hard to be able to target those things. But sometimes you don't know if you're succeeding or not. You know, you're just shooting at a target, hoping that you'll hit it. but it's always encouraging when people give us that feedback. But to be able to do that in a digital realm is also, like you said, it's not easy. We have an amazing team that is behind the scenes putting together all of this, and I cannot take credit for it myself, because it is just the amount of work that goes behind the scenes that people probably will never see and never understand fully, but it is a lot. And I just appreciate that you guys have been in the trenches with us, helping us to frame some of that content and helping us to be able to really brainstorm, put our best ideas together, because you know, we really couldn't do it. It is a collaboration. It is a work together that we have to do together, and to meet the needs of the community, but also to innovate a little bit in this environment, and to really to help people. I think one of the things I've talked about some, and you've probably heard me share some of this before, but I have noticed through COVID especially that you've got needs that are actually increasing. They're not decreasing. People were already feeling alone. They were already feeling like people didn't understand. I mean, anytime you're working in a rare disease type scenario like we have in the bleeding disorders community, you can live in your town and never meet someone else that has a bleeding disorder that is on a similar type of blood product that you are. And so it can feel very isolating to begin with. Well, then you go into COVID, and now all of a sudden you're in a place where you feel even more isolated because you're physically isolated from the rest of the world too. And when, for those of us who do attend events regularly and go to these different things, I know I have felt more isolated than normal. And that's somebody that, you know, I'm pretty active in the community, but even the person maybe who hasn't been involved, they're feeling even more isolated than they were before. And so we're encouraging those folks. This is giving them an opportunity. We've had so many people come and attend these events that we've been doing that have not been, you know, going to physical events before, and now they're seeing it. And I can't wait to meet them in person. I hope they come out when we do get to a safe place to be able to do it all together again. But I look forward to it. But I do think that reaching out to people even online and saying, hey, you're not alone, it's gonna be okay, we're gonna get through this, and trying to be connected and trying to, you know, because we are real people. This is not, you and I are not just a TV screen or a iPad or a phone or something. We are, you know, real life, and we want to keep our arms wide open to invite more people into that circle so that we can have each other to lean on, especially through the hard times. And I appreciate that you have that same vision.
So well said. And yeah, I mean, you know, it's just impressive the work that you guys are doing and the efforts that you're making to keep those arms wide open for those patients in need. And there are families in need. And yeah, we're just very happy that we can be supportive of that and do anything that we can to make that easier and provide resources. So.
Well, it means a lot to us, and I know it means a lot to the patients that we help and serve every day. As you know, we have families that are in the hospital needing financial assistance. We have people that are losing their health insurance coverage. We have all kinds of situations that we work through them almost like case managers on a daily basis. And we could not do the work we do if it was not for the support of your organization and all the work that you do, Tabitha, for us. So thank you so much, truly, for all the digging in and the sacrifice. And sometimes I know sometimes you feel like a broken record trying to make the next thing happen for us on our behalf. And you do such a great job with such a great attitude. I'm so grateful for all the work you do.
Oh gosh, thank you so much. That means so much. You know, I mean, anything that we can do, you know, we have resources for patients that I know you know about, and the patients hopefully will utilize. I mean, we have compassionate care programs. We have free trial programs. We have patient assistance programs for our products. So I encourage anyone to get on the websites and really dig in and review, because there are resources out there if you need it. And I know you have assisted so many patients in helping them find those resources. And you have been a great voice for all the manufacturing companies, and we just so appreciate it. So thank you.
Well, you guys are one of the best. So I appreciate all your hard work, and especially you know, I will give a shameless plug for copay assistance. We work with all of the copay assistance programs out there, and And I do have to say, you guys y'all are one of the easiest to work with. You make it super simple for patients to get that help when they need it. Yeah. And man, it is not a small thing. I mean, we have patients that have huge gaps that they would not be able to access medication if they did not have the additional help to meet those copays, to meet deductibles, to meet premium assistance at times and different things. So you guys are really leading the way with making it simple and easy to access. And we love working with the people behind the scenes to help make that possible for others, because there's a lot of people who really depend on those types of programs.
Well, thank you. Thank you. We're very proud of that. And hopefully we'll continue to expand and grow those services as the patient's needs change. And that's why these types of interactions are very important, so that we can keep in the loop along with our patients and the treatment centers and the physicians and the nurses that take care of these patients. And, you know, it is a huge team effort from, you know, 501c3 foundations through treatment centers, through doctors, nurses, patient families, specialty pharmacies. So, you know, it's a team effort. We're not doing this on our own, and we certainly appreciate that.
Yeah, absolutely. Well, you're doing a great job, and keep up the great work. And hey, look, if you ever decide to figure out how to get an espresso combo going in the infusion, I'm all in. So just let me know when that trial starts. Well, thank you so much. And I look forward to seeing you when it's safe to do so. And man, I'm excited about the future. I do think that we've seen the worst of it, and I'm hopeful that we get to kind of recalibrate next year and come back together. My hope is that 2021 is going to be a great year for Hope Conference, but you know, this is also a great opportunity for people to get involved. So look, if you're watching right now and you're thinking about this and you're thinking, man, these people seem so nice, I wish I knew people like that. Well, look, I can vouch for Tabitha right now that she would love for you to reach out to her. So make a comment in the comment section right now, and we'll make certain that we give you access to Tabitha's email or contact information. If there's any way we can help get you connected, we'd love to do that. And Tabitha's always ready and willing to answer the phone and to help out whenever needed. So just thank you so much again, Tabitha, for always being there for us, and we look forward to talking with you again soon, hopefully.
I hope to see you soon. Everybody enjoy the conference.
Thanks so much. We'll talk to you later.
All right.
Bye.
Okay. Bye.
We're going to take a moment to listen to these messages from our sponsors, and we will be back shortly.
Hey, everybody. Hey, make sure you check out the website. Click on the sponsor links. We've got some door prizes there. We've got some great information there. Also, make sure you're in those breakout sessions, paying attention. We've got giveaways at pretty much all of them where you have the opportunity to win a prize. Make sure you're paying attention, because we've got some questions to ask you. We've also got a game night on Friday night. Make sure you check that out. It's going to be a lot of fun, very interactive, and also maybe you can win something. Who knows? Got to show up to find out, right? And then lastly, the general sessions. Make sure you're in there. We want to hear what's going on. We want to hear you chat with us. Let's have some fun in there. And then also pay attention, because we do have some giveaways in there as well. Anyway, real quick, good seeing everybody. I'll see you in a bit. Bye.
I'm Matt Manzo, and I'm your local Novo Nordisk Hemophilia Community Liaison, or HCL. I cover the states of Michigan and Wisconsin. I've been working in the rare bleeding disorders community for 16 years and found it is really a privilege to get to know people living and dealing with rare blood disorders and everyone in the community. I love spending time with family, friends, and you. For hobbies, I enjoy cycling and golf and some other low-impact sports as I age. As an HCL, I'm here to support you with rare bleeding disorder educational resources. I'm looking forward to connecting with you and learning more about you.
I got interested in music because when I grew up, I had a piano. It was my mother's piano that came from her mother, and it was my favorite entertainment. I just loved it. I've played music all my life. We can trace von Willebrand's back to my great-grandfather on my dad's side. My father had 4 daughters and a son. All 5 of us had a bleeding disorder. My little brother only lived 2 days. Our family was kind of lost. We didn't know anyone else with a bleeding disorder, just ourselves. My sisters and I were considered free bleeders. Von Willebrand's disease can manifest itself in bruises, nosebleeds, heavy periods, cuts that don't heal, in surgeries if you bleed longer. As I became an adult, I wanted to have children, and so I was told it would be not a good idea, but I decided to go ahead and have children. And so with the birth of each child, I almost bled to death. My doctor talked to a hematologist who talked him into not treating me before the delivery of my 3rd child. So with her, without any product in me, I had a stroke and ended up with some residual brain damage, visual damage, and that changed my life. It's a challenge, but I have ways to work around it and try not to let people notice. It helps to have a sense of humor. I'm a person who lives life to its fullest. I get energized on people, so I like to be around people, help people. I love fishing and music, fills my soul. I love being in the family band. That's one of the things that I think our audience appreciates. They see the family closeness that we have. How much I miss you. It's just a real sweet feeling to sing with your husband, but also your daughter. Thank you. There are so many stories that go along with a chronic illness that's not told. I never realized how common von Willebrand's disease was. It affects 1% to 2% of the population. I thought hemophilia was more common than von Willebrand's disease, but it's not. There's a lot of people that have it, they don't realize they have it. For a person waiting to be diagnosed, my heart goes out to them. I would do whatever it takes to get a diagnosis. The diagnosis is so important for children that you might be bearing or children you have to understand how it might show up in your family again. I have a bleeding disorder, but I'm not going to let it ruin my day. I have a treatment plan. I follow that plan. I know there are things that I need to do as an individual to keep myself in the best health possible. Things like annual physicals, going to the hemophilia treatment center annually or as often as needed. Do not take health casually.
Because allergies shouldn't get in the way of a good time. Because a heart attack should never stop the heart of a family. Because hemophilia shouldn't keep someone from doing what's in their blood. At Bayer, everything we do, from advances in health to innovations in agriculture, is to help every life we touch. At Bayer, this is why we science.
Hello, my name is Norberto Lidiano, and I am your local Novo Nordisk Hemophilia Community Liaison, otherwise known as the HCL. My territory includes the state of Florida, South Carolina, the area of South Georgia, as well as Puerto Rico. I have been involved in the rare bleeding disorder community for the past 2 years, and what I have discovered is the commitment, the passion of everyone, as well as the feeling that it's one big family. As your local HCL, I'm here to support you with rare bleeding disorder educational resources. I'm looking forward to connecting with you and learning more about you. Thank you.
Hi, I'm Matthew Flores, National Program Director with InfuCare Rx. You may be more familiar with Factor One Source Fast Pharmacy. We have recently rebranded as InfuCare Rx to focus on our home infusion program, which now includes hemophilia, IVIG, TPNs, antibiotics, and chronic infusibles. I'd like to first mention how much we value the ongoing partnership that we have shared with Hope Charities. And we tip our hats to their team for adapting to a virtual conference format. This is our third year as a sponsor, and we look forward to supporting this wonderful cause for many more to come. At InfuCare Rx, our company motto is "It takes a team." We believe in fostering partnership and collaboration between the entire medical team and support system of a patient. Service is a key motivator behind everything we do. When Factor One Source Fast Pharmacies merged with InfuCare Rx, we did so because we wanted to expand our capabilities around home infusion and infusion suites in order to better serve all of our patients in the coming decade. Together, we have 6 pharmacy sites, 1 nursing and care coordination site, and 13 infusion suites from coast to coast. We are licensed in all 50 states, DC and Guam, which not only means that we can help patients everywhere, it also means that we provide seamless care for families, even if they move or have changes in employment. Our pharmacies have earned prestigious accreditations from the Joint Commission, URAC, and ACHC. Why is that important? It demonstrates our commitment to excellence and our dedication to improving healthcare quality and safety for all of our patients.
Meet Steve. Steve has been suffering from a complex medical condition that's been causing him stress and fatigue. Such conditions require high-touch, personalized medical care. Luckily, there is a solution. InfuCare Rx. InfuCare Rx is a leading nationwide specialty infusion provider. Our dedicated team of experts work together to create a better future for healthcare and an improved outcome for patients. At InfuCare Rx, Steve will receive financial guidance from our enrollment and authorization specialists. Our clinical pharmacists will educate and monitor Steve, while our nurses accompany him every step of the way in a convenient setting. Whether specialty medication or infusion therapy, InfuCare Rx provides comprehensive service for a wide variety of complex conditions. Call InfuCare Rx at 1-877-828-3940 or visit us at www.infucarerx.com today.
Families and individuals all over America are facing new challenges this year. We know times are tough. While these are unprecedented times, our bleeding disorder community has proven itself time and time again to be a resilient group of amazing individuals that know how to come together as a team in times of crisis. InfuCare Rx provides not only the clinical services that you have come to expect from your specialty pharmacy, but also resources, ongoing personalized support, and opportunities during these difficult times. For example, we offer ongoing patient education opportunities, financial counseling, and a robust scholarship program. I'd like to take the opportunity to tell you a little bit more about this program. Our company established a scholarship program in 2015 with the simple goal of helping people living with chronic and complex medical conditions pursue higher education. In just 6 years, we have given away over $50,000 to 20 students. We have helped people coming from many different backgrounds get on the right track to pursuing many different career paths while living with many different conditions, including multiple sclerosis, organ transplants, Crohn's disease, immunodeficiencies, and you guessed it, hemophilia, von Willebrand disease, and rare blood disorders. For those interested, we begin accepting applications on our website at the beginning of each new year. So if you or someone you know would be interested, we encourage you to visit our website, infucarerx.com, and join our scholarship newsletter for more information and eligibility requirements. And to be sure you follow us on social media at InfuCareRx for updates. Ultimately, we want to dedicate this video to all the nurses, doctors, first responders, pharmacists, and all the essential healthcare workers who have risen to the occasion this year and have been heroes to us all. It truly does take a team. Thank you.
Which one is it gonna be, Anthony? The cartoon with the fish or the polar bears?
We always watch those, Grandma.
They're all good movies.
So what's the good news?
There's about 8 million results.
Is that all? When do we start?
How about this? Let me run through what the nurse talked about today and what we should expect when we go in tomorrow. And we can deal with all the pamphlets and these links tomorrow.
Perfect.
Anthony didn't seem nervous at all. He was so chill.
That's great.
I turned to him and said, I'm so proud of you.
That's great. You know, if this is hemophilia, first thing we want to know is how the insurance works.
Right, and that's with the social worker. But with the doctor, I don't want to forget to ask about treatment choices and factors.
Factor?
Right, factor. The medicine we Googled last night.
Come on, Dad. Go.
We're going.
Hello, Amy, Hector. I know that while we've been waiting for the blood work to return, we've been operating under this assumption. And today, the blood work has confirmed it. Anthony has hemophilia A with factor VIII level of less than 1%.
That's considered severe.
Correct. Now, this means you and Anthony will initially need to come in for treatment. You'll learn about
insurance.
What about factor?
Correct. I'm sure you have many questions on many topics. We'll get through it all. We will educate you both, and in time, Anthony, on how and when to take his factor, how much to take, where it comes from, how it operates inside his body, and how it will help keep him healthy. It sounds like a lot, but Nurse Jess and I and the whole team here at the HTC will be here to guide you through. We treat around 100 patients just like Anthony, and whose parents have been in your shoes before. You will become experts on this, I assure you, and sooner than you may think.
Step 1, familiarize yourself with these pamphlets. We have your next appointment down for Thursday when we'll take step 2 together. Okay?
This is big. This is gonna be a big change.
Is this real?
Yeah, but we'll figure it out.
Welcome to the Grifols plant, everyone. Right this way.
Grifols is respected in the hemophilia community for our storied history of being problem solvers and innovators. We pride ourselves in identifying challenges within the community and working to solve them. Today is a great example of that commitment. We needed to teach community members about our plasma products, but the usual pamphlets and PowerPoints just aren't cutting it anymore. So we took some of our engineering prowess and put it towards a special experience crafted just for families like you.
This is our new virtual reality experience. What if you could see where your factor comes from? We wanted to bring you, the community members, directly into our plasma process. We've offered free tour of the plant for years, bringing a handful of patients through whenever possible. But instead of bringing patients to the plant, a virtual reality tour now allows us to bring the plant to patients all over the country.
How do I look?
futuristic.
Thanks to the magic of virtual reality, we can take you through each step of the process, led by our in-house quality control expert, Dr. Jones. Are you ready to meet Dr. Jones?
Absolutely.
Welcome to Grifols.
Hi, Dr. Jones.
We require a pristine plant environment. From the plasma donation center to the plant, rigorous safeguards are in effect at every step in the process to help ensure our plasma products can be taken with confidence. In fact, 5 of our essential steps to safety take place at the point of plasma donation at our plasma donation centers. Now, are you ready for the tour? Deliveries of donated plasma arrive via refrigerated trucks, transported at -20 degrees Celsius or colder.
It looks cold.
We then thaw the plasma to begin the process of centrifugation. In the Viral Control Center, the plasma is run through several processes to separate out the factor VIII protein. The protein is then run through ultrafiltration, concentrating it from around 120 kilos down to 40 kilos. After factor VIII purification, the factor VIII protein moves into its final stage of the process, what we refer to as aseptic filling. Aseptic filling refers to the process of putting a sterilized substance into a sterilized container, like a vial. The custom technology we use was invented right here at Grifols. We even use a special airflow system to help ensure the process is clean and safe before we lyophilize or freeze dry and vacuum seal the vials of what we now can call factor. We believe this attention to detail in creating and bringing you factor VIII treatment may mean you, your child, those you care about can get back to a more normal way of life.
I'm sure you have plenty of questions. You should. My advice is to write them out before your appointments at HCC. It's important to seek clarity and be your own advocate when it comes to your healthcare.
Thank you. You've given us a lot to think about.
Yeah, very cool. But still processing it all.
Me too. It's a lot.
In a good way.
Yes, in a good way. Thank you.
Sure.
Thank you so much.
He's asleep.
Okay, honey, you left your color. Walk. See you soon.
How are you feeling?
Take a guess.
So what's question number 1? Risks of plasma therapies?
Factor.
Factor. I keep saying plasma.
And best practices.
For long-term care.
I think more than anything, I wonder what Anthony's life is going to be like. In the next 5 years or 10 years or 30 years.
Well, that's another good question for Dr. K. What's wrong?
I can't.
What do you mean?
I can't go in. I can't do it.
What's wrong?
What's the point? What's the point of going in there? We can't fix this.
Where's this coming from? We have a diagnosis, finally.
Yeah, but there's no solution. At least not an easy one. I just feel so guilty.
Hey, all parents face challenges. All of them. Remember the night we found out you were the one that told me how to be strong for Anthony?
Really?
Yeah, don't you remember?
What did I say?
You said it was good to be honest about your feelings, good or bad. but to be strong. And then you made me start reading. Everything. Every pamphlet, every Google search result.
Just keep putting one foot in front of the other. Do your homework and ask a lot of questions.
Yeah, I get it though. It all feels very real right now. Like as soon as we go in and start planning with Dr. K, it all becomes official.
Exactly. And it's the start of a long journey. I just really want to get this right, you know? I want to get it right for Anthony.
You want some advice?
Maybe.
It's good to be honest about your feelings. Good or bad. But be strong.
I came up with that.
And just do your homework.
And ask a lot of questions. Whoever came up with that is very smart. And a good parent.
The best. Right?
Now, how have the last few days been?
Well, in all honesty, I felt panicked. There's so much to read and so much to know.
Yes, things can be very overwhelming early on.
But the more I learn about this, the better I feel. I just want my Anthony to be able to lead a comfortable life.
Amy, nowadays, with the products that are available to treat hemophilia,
My name is Nikita, and I'm from Tennessee, and I have the pleasure of serving patients in Arkansas, Louisiana, and Tennessee, supporting the Southeast region. A Sanofi Genzyme Core Manager is a person that has the opportunity to go out into the community. We partner with the local chapters, we provide education, but most importantly, we have the pleasure of listening to the community. It is my role to be that resource to you and your family on all aspects of our company. When my children were diagnosed with hemophilia, the community was right there for me to let me know that I was going to make it through. And this is my way of saying thank you, being that resource to the next family that comes along.
Hi, we're CVS Specialty, and you've come to the right place for specialty medication and one-on-one support. We want to help make living with your specialty condition a little easier. Let's start with getting your medication. Most specialty pharmacies only offer delivery, but with us, you have options. We can provide convenient, contactless home delivery of your medication. But if you prefer to pick it up, we can have it available for you at any CVS pharmacy location. The choice is yours. We also know that taking a specialty medication, particularly if you're new to treatment, can come with questions. So we make sure you have access to a nurse and pharmacist specially trained in conditions like yours. Together, they're known as your CVS Specialty Care Team, and you can rely on them for trusted information. Send your care team a secure message on our website or mobile app. They can help with questions about your medication order status, billing, or even side effects. For even more convenience, use our digital tools to manage your medication. You can refill prescriptions, monitor order status, make payments, and much more anytime online. These are just some of the ways we can help you manage your specialty condition. We're CVS Specialty, and we'll be here when you need us, because you are our specialty.
For more than 50 years, scientists have been investigating and evolving gene therapy, an approach that aims to address a genetic disease, such as hemophilia, at its source, the gene. Genetic diseases can be caused by gene mutations, meaning the body does not have the instructions it needs to create the right proteins. Research is exploring whether a new functional gene can be delivered into a cell to provide instructions to make a desired protein, such as factor 8 or 9 in the case of hemophilia. Together, let's explore the science behind this investigational approach with our 3D vector model. In gene therapy research, we need a way to get the functional gene into the body. A transporter, called a vector, is used. Vectors are made from modified viruses. You may associate viruses with things that make you sick, but the most commonly used virus for hemophilia gene therapy research, the adeno-associated virus, or AAV, was chosen because it is not known to cause human disease. A virus is transformed into a vector by removing the viral genetic information. Now the modified viral-based shell can serve as a delivery vehicle. In a laboratory, the new functional gene is created. It contains the instructions for the cell to make a necessary protein, such as factor 8 or 9. Once created, the new functional gene is placed inside the shell. Together, they become a vector. In hemophilia gene therapy research, the vector is delivered to the body by IV infusion into the blood. The goal is to deliver the new functional gene to the liver cells called hepatocytes. Each viral vector has its own attraction, or tropism, to a certain cell type. In hemophilia, for example, AAV is attracted to the liver's cells. Once the vector reaches the liver, the new functional gene can enter a cell's nucleus or command center, where it sits next to the existing DNA. If transferred successfully, the new gene instructs the liver cells to make the necessary protein. In the case of hemophilia, the gene enables the production of clotting proteins. Safety and efficacy have not been established. Studies of investigational gene therapy are ongoing, and participants continue to be followed. To learn more about gene therapy research for hemophilia, visit hemophiliaforward.com or talk with your healthcare team.
Hi, I'm Samuel, and I'm from Long Beach, California.
Hi, I'm Steve, and I'm from Dallas, Texas.
Hi, my name is Leo Tellez, and I live in Las Vegas, Nevada.
Hi, I'm Kalechi Arunga, and I'm from Silver Spring, Maryland.
Hi, I'm Ed, and I'm from Grafton, Massachusetts.
Hi, my name is Vinay, and I'm from Orlando, Florida.
Howdy, folks. It's Paul from Austin, Texas.
Hi, I'm Ellen, and I'm from Conshohocken, Pennsylvania.
Hey, I'm Michael from Atlanta, Georgia.
Hi, I'm Brian from Orlando, Florida.
Hi, I'm Miles, and I'm from Atlanta, Georgia.
Hi, my name is Lenore, and I'm from Mahwah, New Jersey.
Hi, I'm Craig Watkins in Kansas City.
Hi, I'm Nora, and I'm from Erie, Pennsylvania.
Hi, I'm Mike, and I'm from St. Louis, Missouri.
Hi, my name is Orson, and I'm from Charlotte, North Carolina.
I'm Patrick, and I'm from Libertyville, Illinois.
Hi, I'm Karen, and I'm from Bethlehem, Pennsylvania.
Hi, I'm Jeremy from Denton, Texas.
Kedrion Biopharma produces and distributes plasma-derived products to treat rare diseases such as hemophilia and primary immunodeficiencies. Plasma comes from people, donors, who contribute their precious gift so others, people they most often never know, can live better lives. We act as a bridge between donors and patients by turning plasma into life-saving therapies to serve patients all over the world. Kedrion is headquartered in Italy, with subsidiaries in Europe, the US, Latin America, and Asia. We own manufacturing plants in Italy, Hungary, and the US, and through KED Plasma, we operate state-of-the-art plasma collection centers in the United States and Hungary. Kedrion is the world's 5th player and Italy's first in the field of plasma-derived products. In Italy, we partner the national health system in its self-sufficiency program. At a global level, we distribute in approximately 100 countries, and we are market leaders for specialty treatments, including those used to prevent Rh sensitization. Kedrion started as a small family company, strongly connected to the communities where its people live and work. For us, social responsibility has always been a matter of being a good neighbor. Over the years, while expanding worldwide, we have maintained our role of bridging communities from the local to the global level. Innovation means contributing to improve the quality of life of people affected by rare diseases. Every day, we cooperate with patient and donor organizations, supporting projects that make a difference. We invest in scientific research and disease awareness. We work to broaden access to plasma therapies globally. Every day, we strive to keep life flowing.
Hello, my name is Stephen Lawrence. I take care of patients in Kentucky, Tennessee, Mississippi, Alabama, Georgia, and South Carolina.
Hi, my name is Robin Lawrence, and I take care of patients in Tennessee, Kentucky, Mississippi, Alabama, Georgia, and South Carolina.
Hi, my name is Debbie Costales. I'm in New Mexico and El Paso.
I'm Ed. I'm a nurse that's worked with hemophilia patients for over 24 years. I cover Kansas, Missouri, Nebraska, and Iowa, and the rest of the Midwest.
Hi, my name is Cheryl Ashmore. I live in Chastine, Maine. My territory covers all 6 states in New England. I love working with families, especially kids and teens, to teach transition tools for hemophilia life skills, as well as tips and tricks for how to successfully stick to infusions.
Hi, I'm Vanessa, and I service patients in Missouri, Kansas, and Nebraska. Go Chiefs!
Hi, I'm Karen Price from St. Louis, Missouri, and I'm a specialty infusion nurse helping patients in Missouri and Illinois.
Hi, I'm Judy Bagato. I'm a former treatment center nurse, and I now work with Superior Biologics as an infusion nurse.
Hi, I'm Craig McDonald from Colorado. I've been covering the Midwest for about 20 years in the bleeding disorder community.
Hi, my name's Abdiel Ramirez, and I work for Superior Biologics here in the state of Texas. If you only know how to speak Spanish, I'm also here to help.
I'm Phil Fitzpatrick, an infusion nurse with Superior Biologics.
Because allergies shouldn't get in the way of a good time. Because a heart attack should never stop the heart of a family. Because hemophilia shouldn't keep someone from doing what's in their blood. At Bayer, everything we do, from advances in health to innovations in agriculture, is to help every life we touch. At Bayer, this is why we science.
We would like to say thank you to our sponsors for partnering for our Hope 2020 conference.
Hey, it's hard to get a word in here, but game night, Friday night. We've got a few games going on. Take your pick. It's going to be a lot of fun. Win some prizes. Hopefully I'll see you there. All right, bye.
Thank you so much for spending your morning with us, and we'll see you back here at noon.